Actually, I have a question to Professor Dr. Abdul Samad. Usually, he mentioned that you usually don't treat subclinical mastitis. So my query is, in case of subclinical mastitis, you know the prevalence of subclinical mastitis is higher than the clinical mastitis. So in that case, what do you do for this subclinical mastitis if you don't treat subclinical mastitis? So what are the management practices or some other else you usually practice?
Okay. My first query will be, how do you diagnose subclinical mastitis in such cases? Number one, how reliable is your testing method for subclinical mastitis? Okay. Are you relying on somatic cell count, or you are relying on clots and other things which you are seeing, like physical examination of milk? It depends on that. Otherwise, generally it's a myth. We think that there is subclinical mastitis, but that we don't have any measurable criteria for it. Even if there is a measurable criteria, then what I usually suggest is, if it is a big farm, then all cases should be screened for somatic cell count, and then find out how many cases of subclinical mastitis you are finding, immediately after parturition. Say, for example, somatic cell count or CMT test has to be done at least after 15 days of calving. You don't do before 15 days, because already
Exactly.
somatic cell count is very high during that period. It's a trailing period of the colostrum. So 15 days onward, you can classify your animals into early lactation, mid lactation, late lactation, and then find out in which cluster you have large number of subclinical cases, and depending upon that, I adopt a strategy. And my strategy would be, first, not to treat it with any antibiotic, but start with teat dipping, and then start dry cow therapy with animals that are getting dried off. I mean, that is the strategy which I follow.